All right, well, today is World Osteoporosis Day. It's important to keep our bones healthy and strong, so that way we help our bodies fight off osteoporosis. And you can get a bone health evaluation at TSAOG Orthopaedics. And with us today is Sheeran. She's a nurse practitioner. How are you?
I'm well, thank you. Glad to be here.
Absolutely. Well, it's an important topic. We've got to maintain our bones in working order so we can dance and we can overall feel good.
Absolutely, we definitely do. On World Osteoporosis Day, we just want to really shine a spotlight on the prevention and the early detection and treatment of osteoporosis.
Well, and I guess anybody would agree with it. If you treat it early, you catch it early, there's always something you guys could do about it.
That is correct.
What is osteoporosis?
So osteoporosis is a disease of the bone, and it's caused by either losing too much bone or not making enough, and often a combination of the two. So healthy bone looks like this. You see it's got a nice honeycomb appearance, not a lot of open spaces. When we start to lose bone mass, it looks more like this here.
That's very different.
Lots of open spaces. It is. And that bone is more prone to break. So a simple fall could cause a break, and broken bones, especially later in life, can have a very negative impact on a quality of life.
And I would imagine that would be very painful as well to be living with that kind of condition.
Absolutely.
Who should be checked for osteoporosis, or when do you suggest a person start worrying a little bit about bone loss or anything of that sort?
We should all be aware of our bone health at all times, making sure we get enough calcium and vitamin D in our diet, exercise. But really, women who have gone through menopause and anyone over 50 who has suffered a broken bone. So 1 in 2 women in the United States and 1 in 4 men will suffer an osteoporosis-related fracture after the age of 50. So we really want to make sure we're getting people in because, as you said, we can do something about it the earlier we detect it.
Right, and it's important, especially if you're getting up in age, if you're in your 50s, you don't feel the way you did when you were 20, and it's okay. You just got to do something about it and take care of those bones. All right. Is there a treatment for osteoporosis?
There are treatments, yes. The most important thing is prevention. Like I said before, making sure we get plenty of calcium and vitamin D in the diet. Exercise that improves our strength, balance, and flexibility is very important. Just like our muscles benefit from exercise, our bones do as well. But if we're at that point where we've already begun to lose the bone mass, we have treatments that can help stop and reverse that bone loss, and in some cases even help our bodies build new bone.
Oh, that is awesome. Okay. Bone health evaluation is definitely something that some people may want to do, or that may be at risk or starting to feel like they may have osteoporosis. What happens when you go in and have a bone health evaluation?
So a bone health evaluation is a little bit different than a visit with your regular doctor. We focus on your health as it pertains to your bones. So we will talk about family history, your medical conditions, medications that you take, because there are conditions and medications that can accelerate this bone loss. We'll talk about your lifestyle, so your diet and exercise habits. We can order lab tests and a DEXA scan, which is a bone density scan, that help us determine where your bone density is at this point in time. So these are all tests your primary care doctor can order, or you can come see someone like me that specializes in the treatment of osteoporosis.
Well, I love all this great information that you've provided for us today, and there it is, osteoporosis. It's very common. Make sure you get yourself checked out at TSAOG Orthopaedics, 7 convenient locations here in San Antonio. Their phone number is 630-4650. TSAOG.com is the website. Make sure you follow them on social media. They're on Facebook, also on Twitter. All right, everyone.